Okay, so this is the third video in a sequence discussing with low back pain movement preference and ways to move to decrease the pain. So ultimately, we want you to be able to move all directions, but initially we move in the directions that feel better. So once the pain is calming down, we want to start gradually incorporating the movements that used to be painful to see if they're becoming less painful, so we're ultimately moving in all positions. So we're going to start with two positions where you're supported by the floor, or I'm going to use this treatment table just so you can see, and then some positions in standing. So starting off, we're going to look at this flexion this way and extension, as well as some rotation. So if you remember in the previous videos, we talked about picking between seeing, does this feel better, or does something like this feel better? Now, we want to start transitioning between the two. So if I find that my hips going back towards my heels feel better, I may still do that more. So I usually tell patients a 5-to-1 ratio initially of like the feel better movement to the one that's not so good. So if I do this little self-test and if I say, you know what, it feels better if I do this, and when I do this, that feels a little more uncomfortable. So what I may start off doing is I say, all right, I'm going to go into the one that feels better, and I like this one. I'm going to do 5 of them. That feels pretty good. And then after that fifth one, so that'll be number 5, I'm actually going to take my hands and walk forward and start to drop down into that one that didn't feel so good before. And I might say, ooh, that's a little uncomfortable, and then I'll go back and I'll do 5 more of the ones that feel better. So that's kind of a nice sequence to start initiating movement in both directions. Now, as I do that, right, and I do my little 5 feel good and one that didn't feel so good before, I may start saying like, you know what, this one doesn't feel so bad anymore. So instead of having to do that 5-to-1, I may just do 1 to here, and then 1 coming forward. Like I said, now I'm clearing my ability to move all the way into this bend and all the way into some extension, and now it's not painful anymore, which is a good thing. So I would do that 10 to 20 times with the ultimate goal of being able to go once back, once forward without pain. Same thing with rotation. Previous videos I talked about picking a side that feels better, right? So it's the same thing. If I find that it feels better to lay on my left side and rotate to the right, I may do 5 of those. And for time's sake, I'm not going to do all 5. And I might say, okay, I'm going to go over and try the other side now. And maybe I'll say, oh, that's a little tight, but it's not super uncomfortable. So I would start with that same 5 feel better, one that's a little more uncomfortable, gradually doing equal on both sides. Okay? So that covers 2 positions where I'm supported. And now even better is if I could do this stuff in standing because that's more convenient. So similar to what we did on our hands and knees, we could do that at the counter or at a wall. So if I start off and maybe at the counter I see, you know what, it feels better if I go like this. When I go back like this is kind of uncomfortable. Same idea. I may start off just doing 5 of these guys, just let my pelvis slowly drop in towards the counter, keeping my elbows straight. And if I do the 5, then I maybe do 1, I'd say, I don't feel anything, starting to feel a little uncomfortable, and then I'm going to do 5 more of these. With the ultimate goal of saying, you know what, this doesn't feel too bad, it just feels like a normal stretch, so maybe I'll just do 1 to 1. Okay, so all of these, initially when you do them, do more of the one that feels better. As that's starting to be comfortable, see how it feels just to go from one extreme to the other. Okay? The ultimate test is always going to be, as you're doing any of these things, do they feel like they get easier, do they hurt more, or do they stay the same? So as long as it's getting better or staying the same, you can go both ways. But if you're doing it, you're saying, this is kind of hurting me, go back to doing the one that feels better and gradually reintegrate the one that is giving you problems. So that covers, same thing, this forward to backward and more of a standing position. The next thing is going to be this side bending or lateral shift. So maybe at first, I can do this with my hands straight, or I can do it leaning against the wall on my elbow. So for this one, I'm going to say, okay, how does it feel when I go this way? Compared to when I turn around and I go this way. If I find one that feels better, same story. All right, these ones in standing are better because now this is more of a functional position where I have a little bit of weight on my spine because I'm standing. So same idea, pick the one that feels better, do it more, but ultimately you want them to feel good both ways. And you'll see at first I made the mistake of letting my shoulder shrug and I Even thought to myself, that's not a good idea. I want to keep my shoulder down, my elbow straight. It's not a big movement. And you'll see, just like I started to do when I wasn't thinking about it, I let my pelvis drop in and I let my shoulders shrug up like this. I don't want to do that. I want to keep my shoulder down, in a little bit, and back out. So that covers front to back with this position at the counter. That covers side bending with this position at the counter. And the last one is rotation. And I like holding on to something, pillowcase or towel. And it's going to be the same question. As I stand here holding this pillowcase, and I turn to the left, and then I turn to the right. If one feels better, I'll do my 5 to that direction, and then 1 to the direction that doesn't feel so good. As they feel like they're starting to equal out a little bit, I may just do 1 to 1. All of these things will actually fit into a nice warm-up sequence. So if you have that history of back pain that's calming down, this is a nice little check system to see if there's any of these movements that are still limited, and also a way that if you have a flare-up, you pick the ones that feel better, that we talked about in the previous videos, with the eventual goal of being able to move both ways and doing it in more of a standing position. So I hope this is helpful.